In addition to the social distancing recommendations, keeping at least 6 feet away from others and avoiding areas of social gathering, the Centers for Disease Control and Prevention strongly suggest wearing a face mask while in public. Wearing a face mask not only helps protect you from getting the COVID-19 virus, it could help prevent its spread if you already have it but don't show symptoms. What type of mask is recommended? The CDC suggests wearing face masks made from multiple layers of cloth or fabric, secured with ties or ear loops. They should be machine washable without being damaged or changed and should allow you to breathe unrestricted. The CDC is not recommending N95 or surgical masks, as those are crucial supplies for medical workers. Removing and washing. When securing or removing your face mask, take extra care not to touch your eyes, nose, mouth, or any part of your face. And remember to wash your hands immediately after removing. You should wash your mask regularly in the washing machine. Making your own mask. There are several ways to make masks depending on your supplies. Please follow the accompanying link for instructions on how to make them. Masks can be constructed using cotton fabric, elastic bands, and a sewing machine, a t-shirt and scissors, a bandana, coffee filter, rubber bands, and scissors. As an essential worker, it's critical you do your part to prevent the spread of COVID-19. Wearing a face mask can protect you from getting or giving the virus to someone else. For more details on making, wearing, and cleaning your face masks, please visit the CDC site, www.cdc.gov/coronavirus/2019-NCOV/prevent-getting-sick.